Hello everyone, I'm Dr. Lương and I'm from National Hospital of Dermatology and Venereology, Vietnam. It's an honor for me to be here in this wonderful meeting. And as we all know, psoriasis is chronic inflammatory disease and it affects not only skin but many other internal organs as well. In the past decades, many studies draw attention to comorbid condition in psoriasis. By this, my presentation, I'd like to talk about comorbidity and the risks and how to manage them. Let me remind some information of psoriasis and stop thinking about psoriasis as a skin problem. Problem is much deeper than that, like joints, nails, cardiovascular system, digestive, and is called a systemic inflammatory disease. Third, greatly affecting the quality of life. Some picture of psoriasis patient. And today we talk about more silent comorbidity such as metabolic syndrome and mental disorder. There are common disorders that are often overlooked by patients, and we are not aware of their dear consequences. All issues like physical health, mental health, family, and healthcare costs affect about the psoriasis patient. And we talk about comorbidity and complication. Some of the most comorbidity mentioned is like cardiovascular disease, hypertension, obesity, dyslipidemia, diabetes, and anxiety and depression. We found that inflammatory cytokines in psoriasis, such as TNF and interleukin, have close relationship with the both disorder. On the other hand, mental disorder has also been mentioned in recent years, and so need to only clear lesion, control morbidity, but also improve the quality of life and mental health for the people of psoriasis. And the first, we talk about cardiovascular disease. There has been increasing awareness of the link between psoriasis, cardiovascular risk factors like hypertension, type 2 diabetes, dyslipidemia, metabolic syndrome, and cardiovascular disease. Cardiometabolic disease is prevalent among patients with psoriasis, especially those with more severe skin disease. Inflammatory cells and pro-inflammatory cytokines contribute both to the development of psoriatic lesion and to the breakdown of atherosclerotic plaque. And when cardiovascular risk factors were adjusted for, patients of psoriasis still has increased risk of stroke, atherosclerosis, MI, CAD, and endothelial dysfunction. The patient with severe psoriasis we found to have a 5 years shorter life expectancy with cardiovascular disease, contributing significantly to the discrepancy. And hypertension, the exact mechanism underlying the relationship between psoriasis and hypertension is unknown, but hypertension is more prevalent among patients than without psoriasis, and more severe hypertension and probably control blood pressure among psoriasis patients. Importantly, a study of patients with hypertension suggest more severe hypertension and poorly controlled blood pressure among the patients with psoriasis compared with patients without psoriasis. The next one, obesity. Obesity defined as a body mass index over 30, and the exact link between psoriasis and obesity is not clear, but obesity is a well-known risk factor for psoriasis. And obesity and production of pro-inflammatory cytokines are associated with clinical subtype and severity of psoriasis. And it's important to remember that obesity alone not cause psoriasis. And in addition to obesity, there are many other risk factors for psoriasis, such as genetic, certain medication, and smoking. Losing weight can have a major positive impact on psoriasis, and weight loss through diet, exercise, and can decrease both of severe signs of psoriasis patches. And weight loss can make psoriasis medication more effective. Some picture show that the obesity could play some role of trigger psoriasis based on chronic pro-inflammatory state that is produced, or it could be consequence of psoriasis, a reason for metabolic disorder, and added to loss of quality of life and eating habits of individual with the disease. And being overweight also increase the risk of PSA compared to people with the normal BMI. And the next, we talk about dyslipidemia. Dyslipidemia may be more prevalent among patients than without psoriasis, and hyperlipidemia is also directly related to coronary artery disease. The diabetes, type 2 diabetes mellitus is a metabolic disorder characterized by increased insulin resistance and hyperglycemia. And psoriasis can become more difficult to control in people with diabetes because the risk of infection and medication use. And the reason we talk about the mood disorder in psoriasis patients. Most mood disorders are common among patients with psoriasis, and psoriasis associated with increased risk of depression, anxiety, and suicidal ideation. The symptom, we look the picture. The symptoms of psoriasis, including painful skin lesions that itch, sting, and bleeds, may affect more than just the patient's skin. The condition also has a negative effect on the patient's well-being, giving rise to anxiety concerning personal appearance, emotion distress, and feeling of shame, low self-esteem. In short, it often has to considerable psychology repercussion, and it associated with anxiety and depression. We look the picture about more than 19% people with psoriasis show that they had a problem with daily life, and they had overall emotional well-being. So how to manage psoriasis and comorbidity? We remember prevention is important. We can prevent psoriasis trigger as well environment factors like BMI, stomach infection, and maintain healthy diet, exercise, and maintain stable weight. Some principle of treatment we can remember. The first, early diagnosis and early treatment, and comprehensive care, minimizing risk factor, discuss with the patient about methods like medication, diet, and exercise, educate patient on treatment enhanced and personalize of the treatment. About the treatment, early treatment could reduce inflammatory cytokines that minimize the risk of the systemic inflammatory. Biologic therapy rapidly reduce inflammatory cytokine. We can use early for the patient with severe psoriasis and comorbidity. Screening for comorbidity before and after treatment at least every 6 months, and coordinating specialists like cardiology, psychiatry, gastrology to the treatment is necessary. And the diet, a healthy diet and healthy exercise is important. It have maintained in ideal ways and reduce the risk of diabetes and dyslipidemia, thereby also helping better control of psoriasis. We can see some the fruits and some vegetables, some food that have high inflammation and food that can contribute to inflammation, and some exercise you can avoid. And my presentation, some show about the take-home message. Psoriasis is not only a skin disease. Early detection and treatment of many comorbidities associated with psoriasis is important. An integrated approach should be taken to ensure that treatment of psoriasis does not interfere with the management of comorbidity and vice versa. Thank you.